Well, welcome to my Nclex Bootcamp. I'm very happy that you're here today. My name is Brian. I am a nurse practitioner. I've been an RN since 2007 and became a nurse practitioner in 2009. I struggled in nursing school, and my main goal with this Nclex Bootcamp is to provide you with the tips and tricks that I have used to get through my Nclex boards and my nurse practitioner boards the first time around. This is not a review of content. I am teaching you how to study for the Nclex. So some of the things that we're going to review in this Nclex Bootcamp, we're going to do a background information on the Nclex, how to help you prepare, positive thinking, how to prepare a vision board, vocabulary, flashcards, types of questions, how to go through those questions, assessments versus implementations, how to answer questions when you get trapped, what to memorize for the Nclex, what to do when you get cornered. Practice makes perfect. Nclex countdown and learning disabilities in the Nclex. My bootcamp is not designed to go over content. You can learn content until you're blue in the face over and over again. I've met people who have failed the Nclex 9 times. Content is important. The reason I created this bootcamp was not to go over content because there's so many resources out there. My goal is to teach people how to effectively study for the boards so that they can get more questions correct. Okay, there's one thing I want to discuss about the Nclex, and they might have gone over with you in nursing school, they might not have. Remember, the Nclex is a test of minimum competency. It wants to make sure that you basically will keep a patient alive. And so that's why a lot of people, some people have 75 questions, some people have 265. When you're on the border, the last 5 questions are the most critical of the test. And this is where you want to focus your energy at the most important time. If you're on question 70 and you're right on the cusp of the passing of the Nclex, and you get question 71, 72, 73 wrong, you're going down lower and lower on the Nclex border of minimum competency. And so those last 5 questions are the most crucial. Now, some people shut off after 75 and fails because they were under the reference range of passing by question 75. If they're in the borderline, the test keeps going on and on and on. The goal is to focus your energy on the last 5 questions, as they're the most important, in my opinion, on passing the Nclex in 75 questions. I'm going to go over the power of positive thinking. They don't talk about this in nursing school at all, but it's the most important thing into passing the Nclex. Think good and it will be good. I highly recommend that you read The Secret. It's a very important book that you should read while in nursing school or wherever you are now. It is about the power of positive thinking, that negative thoughts will only bring negative things into your life. Now, it may be silly for me to talk about this on this webinar, but it has dramatically empowered me in my career and allowed me to achieve lots of success. So you have to think positive, as it will bring in positive things into your life. You need to envision yourself as being a nurse, as passing, as working on the floor. And remember, the Nclex is a test of minimum competency. That is why I recommend you create a vision board. Take a big piece of cardboard, and it is critical to your success to have a vision board where you put a picture of yourself being a nurse. You can actually take your picture, print it out, and either do it online or squiggle in, put a nurse stethoscope around your arms and envision yourself. And when you wake up in the morning, you look at that vision board and you say to yourself that you could do this and you made it through nursing school. Nursing school is very hard, and by itself. If you got through nursing school, or if you're in nursing school, the point of this boot camp is to help you and empower you and to give you the right ways of thinking. My goal is to be a resource and a coach for you. I'm going to talk briefly about people with learning disabilities. If you have dyslexia, ADD, or any type of learning disability, auditory, visual, many of you know you could get accommodations, maybe you don't. You could have it's time and a half or double time depending on your disability, and you can have a private room where you can speak out loud. Remember, on the Nclex, you can bring in pen and paper, highlighters. I highly recommend bringing that stuff in, and if you feel you do have a learning disability, I would apply to get those extra provisions. I was living in Cleveland, Ohio at the time, and I actually need a private room, and I had to drive all the way to Pittsburgh in order to get the accommodations that I need. So I understand what it's like. You may have to travel further if you want to take the Nclex sooner, but it's definitely worth having those special accommodations so that you succeed. Okay, I'm just going to spend a few minutes going over how the Nclex is divided, and I don't want to bore you guys with this, as you probably know a lot about it already, but I really feel it's important to kind of have a infrastructure. So the first area of the Nclex is safe and effective care environment, which is divided into management of care and safety and infection control. Then you have health promotion and maintenance. Then you have psychosocial integrity, and you have physiological integrity, which includes basic comfort and care, pharmacological reduction of risk, and physiological adaptation. So we're going to talk about integrated processes just for a brief minute or two. The following 5 items are fundamental to the care of nursing. So you have the nursing process, a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. So you got that area. Then you have the caring, the interaction of the patient and the nurse in an atmosphere of mutual respect and trust to build rapport. In this collaborative environment, the nurse provides encouragement, hope, support, compassion to achieve the desired outcomes. Step 3 is communication and documentation, verbal and nonverbal interactions between the nurse and the client's significant others, and the other members of the healthcare team. Step 4 of the integrated processes is teaching and learning, facilitation of the acquisition of knowledge, skills, and attitudes, promoting a change in favor. And step 5, cultural and spirituality, interaction of the nurse and the client, individual, family, group, including significant others and population, which recognizes and considers the client's reported self-identified, unique, and individual preferences to client care, the applicable standard of care and legal instructions. So this is just a brief overview of the different areas of the Nclex. We'll talk about more on the next slide, how it's divided up into different percentages. Okay, so this slide talks about the distribution of the Nclex. So it's kind of important to know. A lot of people freak out, oh, I suck at this OB, or I suck at med-surg, or this area is really hard for me. And they're concerned about how they're going to pass the Nclex. So I just wanted to provide this slide to you. You might have seen it before. It's a pretty standard slide. But if you look at it, you can see that management of care is only 17 to 23%. Safety and infection control is 9 to 15%. Health promotion and disease maintenance is 6 to 12. Psychosocial 6 to 12. Basic care and comfort 6 to 12. Pharmacological 12 to 18. Reductions of risk is 9 to 15. Physiological adaptations 11 to 17. So what this means is that when you take the Nclex into a pie, these are the different percentages of the types of questions. So you may struggle at one area, but have a strength at the other. You can still pass the Nclex. So it's not all med-surg. It's not all pharmacology. If pharmacology is your weak point, you can still pass the Nclex because it's only 12 to 18% of the entire Nclex. So when you kind of dissect how the Nclex is divided up into different percentages, it helps empower you to know that if one of your areas is really weak, you can still pass the Nclex because it doesn't take up 100% of the Nclex. Okay, I'm going to go over this. You guys probably know all about this, but I figured I would just go over it briefly in case it's been a while since you took the Nclex. I know a lot of people fail the Nclex and then they just give up. Well, I'm here to tell you, don't give up. Part of this Nclex Bootcamp is to teach you the skills to succeed. The first phase is just going over the core infrastructure of the Nclex. In the later part of this boot camp, we're going to be drilling down on how to study and how to prepare. I want you guys to be prepared for the types of questions that you'll see on the Nclex. You're going to see multiple choice questions, fill in the blank questions, multiple response questions, ordered response, figure hotspot. So I'm going to give you an example. Figure hotspot. It may ask you a simple question. Where's the midclavicular line? And if you don't know that, you're kind of screwed. So we're going to be talking about what to memorize and in the next few slides. But part of this is just basic knowledge, and part of it is more complex critical thinking. They always talk about critical thinking in nursing school. So there's different types of questions. Some of them are just basic knowledge. If you don't know it, you're kind of out of luck. You're just guessing. And then there's more critical thinking questions. Okay, so the next types of questions are the chart or exhibit, the graphic option. In this format, options are pictures. Each option is preceded by a circle that you need to click to represent your answer. There may be audio or video as well. So this is a rough overview of how the Nclex is divided up. Now, you know that it's divided, every section of the Nclex has a different percentage of the whole pie. And these are the different types of questions that you'll see. I'm going to talk now about nursing school. Nursing school, specifically instructors in this nursing school. When I was in nursing school back in 2007, it was really hard. Most of the professors, they're very lazy. I'm just being honest. What they do is they review med-surg by the textbook. They know it all already. And when it comes time to make their test, they simply pull sample questions on that topic from a bank of questions. And so if you don't know the format, or if in nursing school they don't teach you how to study, how to dissect these questions, it's going to be very challenging. So most of the professors will simply just pull Nclex questions in order to generate your test. They're not handwriting your test. They're very lazy, in my opinion, and they don't prepare you for the Nclex. So the quicker you learn the format of the Nclex questions, the sooner you'll improve your scores on the Nclex. So just remember that your nursing instructors in nursing school are not handwriting these tests. They're simply just pulling them by the section of where you are on that topic. And they may change it a little bit, but they're just pulling from these question banks. So just remember that. So now the next section of this Nclex Bootcamp, we're going to go into tips and tricks on how to get better results on your Nclex Bootcamp, how to get better answers, how to answer questions better. So I'm going to go over tips. Don't read into the question. Never assume anything. It makes an ass out of you and me. You want to watch for grammatical inconsistencies. And a tip, if a patient is in distress, you don't administer medication. Remember, ABC is the way to go when a patient is in distress. So now we're going to go over how many questions should you take in order before you sit down for the first Nclex. I asked a lot of nursing students, how many questions have you done? Oh, a few hundred, maybe 1,000. Well, most experts in the field say in order to prepare for the Nclex properly, you need to do at least 3,000 to 5,000 sample questions. Once you get used to the format of the Nclex, this will make it easier. So if you're someone who struggled with the Nclex, if you've taken the Nclex before, or you're fresh out of nursing school and you're just not ready, or maybe you're in nursing school now, do at least 3,000 questions. You're going to appreciate this once you've done them. We're going to talk about flashcards and how to utilize those in the next few slides. But I recommend any student who either struggles in school, myself included, I was not an A student like a lot of the people there in nursing school. I was actually on academic probation because it was so challenging to learn the material. And the sooner you get used to doing the questions, that's why I recommend if you're in nursing school now, when you have weekends or when you have vacation time, grab tons of books and do thousands of questions. Keep track of how many questions you've done. You want to hit at least 3,000 to 5,000 before you walk into the Nclex. Okay, we're going to talk briefly now about vocabulary. Just simple vocabulary that can really goof you up on the Nclex. See, nursing school, you go, you sit in the lectures, you go to the lab, you just kind of do what they tell you, but they don't help prepare you for the Nclex. One of the most basic things as being a new nurse is just knowing basic vocabulary. Many times the Nclex questions may test your knowledge of simple medical words or phrases. However, if you don't know the meaning of the medical word, you could get stuck and pick the wrong answer. So you may not know the definition of a medical word yet. If you don't know that, it's going to goof you up. You may not get the question right. It may lead you down the wrong path of thinking. And that's why it's very important that you memorize as many vocabulary words as possible between now and when you take the Nclex. So this next slide is just another example of how vocabulary is critical. That you memorize the most common medical terms so you don't get lost. For example, erythema means redness. Dysuria means burning with urination. And hematuria means blood in urine. Simple things like this can very easily mess you up and get you down the wrong path. If you haven't memorized the most common medical terms, it's going to be very challenging for you on the Nclex. If you don't know erythema means red, you may not know how to answer the question. You'll just be guessing. So it's very important that you start memorizing the most common medical terms. That dysuria means burning with urination. The hematuria means blood in the urine. The sooner you memorize these things, the easier you will be able to prepare for the Nclex because you'll know what it means when they ask you that question. Okay, we're going to talk about flashcards right now. Flashcards were the key to my success. I passed the Nclex the first time around. I passed the nurse practitioner boards in 2009 the first time around. I literally had thousands of flashcards. Flashcards are the number one way to increase your general knowledge and prepare for the Nclex. Remember that you can only learn so much in nursing school. If you're in nursing school now, I highly recommend that anything you don't know when you're going over a topic, make a flashcard on that. If you're after nursing school or if you've taken the Nclex more than one time and you have not passed, I would like for you to go out and buy about 3,000 blank flashcards. You're going to have to use flashcards to help your brain learn as much information as possible. Remember, you can only learn so much in nursing school. If you miss one medical term or concept, you'll get cornered and trapped, and you may pick the wrong answer. So flashcards are very important. We're going to go over flashcard etiquette in the next slide. Okay, so I'm a visual learner. When I was in nursing school, I would literally draw my flashcards. I would use highlighters. I would draw on them to help associate the content on the other side. I'll give you an example. I would learn the word hematuria, and I'd be silly. I draw a couple drops of blood with a red pen or red highlighter on the word hematuria, and immediately I was able to associate that the visual thing that I would write hematuria on the one side of the card, on the other side write blood in the urine. But how do I tie the hematuria over here and the word blood in the urine over here? I would use a visual aid. I would use a colored pencil, color marker, or highlighter, and I would draw a couple drops of blood just to show a picture, and then I would be able to associate that in my brain with the word hematuria, and it would click right away. Or I would draw a funny squiggle or a smiley face. You have to kind of associate one side of the card to the other, and by doing something silly and funny, you can actually merge those together so that it will help you learn as much content as possible. Then, when you're learning the flashcards, there's something called flashcard etiquette. You know, most people hold about 100 flashcards in their hand, and they don't know it, they put it at the back of the pile. You know, they keep going. Well, there's no way, if you're holding 100 flashcards, you're going to get something you don't know into your memory. So, just remember, it goes from short-term memory to long-term memory. So what I recommend you do is you hold about 25, 30 flashcards in your hand. And if you don't know it, you know, first draw a picture to help tie in, for example, hematuria. You're going to take a red color marker and draw on it. Then what you're going to do is instead of putting it at the back of the pile, you'll put it 5 cards back. Okay, you'll keep doing your next flashcards. Okay, after 5 flashcards, you're going to see the word hematuria. It's going to kind of be, oh, I remember it a little bit. You know, you may not remember it immediately. You're going to flip it over. You're going to say blood and urine. You're going to tie those things together. Then you're going to put it 5 cards back again. Okay? Okay, next time around, you keep doing flashcards. What happens? You get to the 5th card. You see the word hematuria. Oh, now I know it's hematuria. So then you're going to put the card 10 cards back, approximately. You don't have to count. It just, you know, you put it about 10 cards back in the pile. So then you keep going through your flashcards. And then what happens is you get down to the 10th card. Oh, it's hematuria. You've automatically associated in literally a minute what hematuria is. Use the visual thing in your brain with the color red, and then you repeated it many times in a short period of time, and then you immediately will associate hematuria as blood in the urine between the visual aspect of drawing on the flashcard, okay, and the rapid repetitiveness of doing it 5 to 10 cards back. It will help put in your memory from short-term memory to long-term memory. And then what you do is you put the flashcard 30 cards back or the back of the pile, and soon as you start doing this, the material will start going into your brain easier and easier, and you'll memorize all this stuff. So that's my rant on flashcard etiquette. You know, at the same time, once you've memorized what hematuria is, okay, you want to then go in reverse and do the same thing, blood and urine. What is hematuria? So that will help you associate it. I recommend every student have about 3,000 to 5,000 flashcards, and that you label them by subject matter. You know, if it's pharmacology, if it's med-surg, in the bottom right-hand corner, just with the initials MS, med-surg, or psych, PS. These will help you keep your flashcards organized. It's very important to do flashcard etiquette. So in the rest of the boot camp, we're going to be talking about how to dissect the questions. So the first sections were just a brief overview of the Nclex, vocabulary and flashcards, and flashcard etiquette. It's very important that flashcard etiquette is an integral part of your studying. We're going to move right along in how to dissect questions now. Okay, so we're going to talk about the number one thing is assessments and implementations. We'll be going over the Kaplan decision tree and dissecting it shortly, but this is the number one thing I want to teach you guys. Determine if the question is asking you to assess or implement the patient. Not all of the questions are A versus I questions, but a lot of them are. And so this is the number one thing that students get tripped up on. Is you want to determine if the question is asking you to assess or implement. So you ask yourself the question. If it's assessing, then you're going to do assessing. If you're implementing, then you're implementing. So if all the question is asking you to assess, then you can eliminate all the implementations. And then vice versa. If the question is asking you to implement, you can eliminate all the assessment answers. Well, what does it mean to assess? Assessing means you are either obtaining a history on the patient or performing some type of physical exam. Examples of assessments include asking the patient questions, auscultating the lungs, medication reconciliation, listening to the patient's heart. These are all assessments. So now what we're going to do is we're going to go over what do you do when you get cornered in a question and you have no idea what to do. You're feeling panicky. You may want to skip it on the Nclex and come back to it later. And what's the proper procedure in kind of dissecting these questions? So, and I recommend this not when you're stuck, but kind of on every question. When you're in a situation where you're not sure what to do, you need to take a deep breath and relax. You need to close your eyes and take a moment to reread the question. I would always reread the question multiple times. You got to read it 2 times. 2 times before you even look at the answers. Students so often look at the answers right away. No, you want to read the questions 2 times, then you take a pen and paper and you write out the question. So you're rewriting the question so you properly understand it. Then you read the stem 2 times and you ask yourself, what is this question asking me? That is what the proper procedure is to do before you look at the answers. So in the next slide, we're going to do a sample question, and I'll show you how to dissect it. Okay, here's a sample question. So very simple one, but may trip up some students if you don't know how to dissect it. What is the first intervention for a patient having chest pain and a pulse ox of 86? So again, we want to look at this. We're looking for the key words. So I'm going to read the question 2 times. What is the first intervention for a patient having chest pain and a pulse ox of 86%? So I've identified what is this question asking me. I want to know intervention. So now I have to ask myself, are there some interventions and assessments buried in these answers? Well, option A, listen to the patient's lung sounds. Option B, administer oxygen. Option C, obtain a full history. Option D, administer nitro. So if we look at A, B, C, D, we can immediately determine that option A, listening to the patient's breath sounds, that's an assessment. So the question is asking you to intervene. So you can immediately eliminate option A from your list. Okay, option B, administer oxygen. Well, administering oxygen is an intervention, providing patient care or medical treatments. So that could be an option. Well, let's keep going. We don't want to assume anything. Option C, obtain a full history on the patient. No, that's an assessment. Okay, you're assessing. Part of it, getting history is assessment. And option D, administering nitroglycerin. Well, option D is an intervention. So now we've eliminated option A and we've eliminated option C. So now we just have to pick between option B and option D. Does that make sense? How I've eliminated 2 of the answers? Some of these questions on the Nclex, there'll be 3 assessing options, and it's asking you to intervene. You can eliminate all 3 immediately. This one, you're down to a 50-50 shot. So you know it's option B or it's option D. Now, I said before, tips and tricks, when someone's in distress, you rarely give medications first. So the answer is option B, administering oxygen. Why? Because patient's pulse ox is 86%. You would first want to increase their oxygen by putting it on, and then you would go on to giving nitroglycerin. So you would correct the low pulse ox first. Okay, so I'm going to go over what we did just now. We followed the following steps. We didn't look at the answers, because this can always make you pick the wrong answer. We read the question 2 times, and we read the STEM before picking the answer. We asked ourselves if this question was asking us to assess or asking us to implement. I was able to determine that it was an implementation question, not an assessment question. So we'll be going over that briefly in the next few slides. We're going to dissect the Kaplan tree. But before we dissect the Kaplan tree, I want to go over the nursing process just one more time. You want to assess the patient, which is collecting data. Nursing diagnosis, analyzing assessment data to determine diagnoses, outcome identification, identify expected outcomes of the client, planning, implementation, and evaluation. These are all the key areas of the whole nursing process. They probably went over this in nursing school. Now, the next slides we're going to do is we're going to dissect the Kaplan decision tree. So you might have heard about it. You probably attended Kaplan, but maybe you don't understand it. So we'll be going over that next. So the Kaplan decision tree, the most famous decision tree in answering Nclex questions. So you want step number 1. Can you identify the topic of the question? This is step number 1. So I dissected it so that we could go through it together. So the question is yes or no. Can you identify the topic? So if yes, as you can see, it says proceed to step 2. If the answer is no, you can't identify the topic. You read the answer choices for clues. Identify the topic of the question, and you then go to step 2. Now the trap is Nclex hides the topic of the question. So you want to find out what the question is really asking yourself. They are very sneaky. You cover all of the answer choices and you read the STEM and you repeat. So read the STEM 2 times and repeat. Very important to identify what the topic is. I recommend doing this on pen and paper when you're doing sample questions or when you're sitting down on the Nclex and actually doing it. Is you want to identify topic and determine what it is. Okay, we already went over this before, but I wanted to dissect it earlier and now go over it with you again as part of the whole Kaplan decision tree. Step 2 is very critical, and this is where a lot of nursing students kind of may make critical key mistakes. Is it asking you to assess or implement? We went over this already. I'm going to go over it again. So you have to determine, is it a mix of assessments and implementations? And that's what happened in our sample question. 2 of them were assessments, 2 of them were implementations. You read the STEMs to determine if you should assess or implement, and you select the correct answer. The next option is, are all the answers assessments or implementations? You go to step 3. And the trap here is validation required. So just to recap, step 2 of the Kaplan decision tree is you have to determine if it's an A or an O question. And if all A or O, go to step 3. So we're going to move on to step 3 now. Step 3 of the Kaplan decision tree, does Maslow's law apply? So if the answer is no, are all the answers physical? You proceed to step 4. Are all the answers psychosocial? You go to step 5. Well, maybe Maslow's does work. So the answer is yes. You eliminate psychosocial answers. Does the physical need to make sense? Apply the ABCs. But the trap is physical needs to take priority over psychosocial needs. So just to recap this step, does Maslow's law apply? Determine if it's a mix of physical or psychosocial. If physical goes step 4, if psychosocial goes step 5. Okay, so step 4, are all the answers physical? If the answer is no, you'll see what we do in step 5. If all the answers are physical, you apply the airway, breathing, circulation. The trap is don't automatically select respiratory answers. Make sure the answers make sense. And step 5 of the Kaplan decision tree, what is the outcome of each of the remaining answers? You determine the outcome of each answer. Is it desired? The trap is don't select answers that sound right. Make sure the answers make sense. So that's the Kaplan decision tree. It's helped me. I recommend analyzing it and memorizing it because it's very important that you know it backwards and forwards so that you can apply it to the Nclex. If you already have taken the Nclex and you haven't passed, you want to ask yourself what went wrong. Was it the content? Were you too nervous? Remember, you can learn content until you're blue in the face, over and over again. But if you're too nervous, some students have found propranolol helps. You could go to your doctor and see if you could get a prescription for it because maybe you're too nervous. The number one key to your success is hitting as many sample questions. Now, one thing I didn't say is when I was in nursing school, after I graduated, I was not prepared at all for the Nclex. My school, I was at Case Western Reserve. I didn't feel at all prepared to take the Nclex after I passed. I spent 3 months studying night and day. I would make flashcards over and over again. If I did a question and I got it right, but I didn't know why I got it right, I would make a flashcard. Anything I didn't know, I made a flashcard on. I literally had thousands of flashcards because it's the only way you're going to learn the material. You don't know what the Nclex is going to throw at you. But what you can do is you could create a study schedule. You could study consistently. You can do flashcards and flashcard etiquettes, and you have to hit 3,000 questions before you walk into that Nclex so that you feel prepared. This is just a sample study calendar that I found online. The link is down below. This is something that you can make yourself. I would recommend creating one. What I did when I finished nursing school, or if you're in nursing school now, remember, nursing school does not prepare you for the Nclex. This is my opinion. It prepares you to be able to sit for the Nclex, but you need to get coaching to prepare for the Nclex. So you want to create a sample calendar like this. If it's 4 weeks, 2 weeks, 8 weeks, you want to review the content, but you want to do, your main area is doing hundreds of questions, spending hours doing that, and then putting in your calendar time to do flashcards. Flashcards are the number one way, if you follow the etiquette that I taught you, to increase your chances of getting answers correctly and knowing the content when you get confused or not sure. So you can make a sample question like a sample calendar like this, where you want to take 100 question test and then review it. When you're reviewing the answers, I would spend time reviewing them. If you don't know why you got it right and you just were out of luck, let's say you luckily picked the correct answer, you still want to make a flashcard on it. You want to know the content backwards and forwards. And if you got the answer right because you knew it, don't make a flashcard. But if you got it right because you were just lucky and you picked the right one, I recommend making a flashcards. You want to do at least 3,000 questions before you walk into the Nclex. What you do the day before the test. I wouldn't recommend doing any questions the day before the test. I would spend your time focusing on flashcards. I would take a big magic marker and put an X through every flashcard that you know the content backwards and forwards. I would take a magic marker and put a slash through it if you know that content, if you know that side. And you just want to kind of X out as many flashcards as you know. I would spend the morning doing that. Then in the afternoon, no content review. You need to relax and decompress. You need to do whatever makes you happy. If it's going to the movies or getting a massage or going out to eat or just relaxing, you want to stay calm and relax and make sure you're prepared. Make sure you know where you're going for the tests. And make sure to leave bright and early in the morning so you have enough time. One of my recommendations is the mnemonics from this company, Nursing Labs. I highly recommend their books. I highly recommend that you get their flashcards. I recommend what you do is you take these flashcards that you could get, and if you can't afford them, that's fine. You can make your own. But these flashcards are integral part of your learning, but I would actually take them, since I'm a visual and auditory learner, and rewrite them on regular flashcards. I highly recommend Nursing Labs, and there's a nice app called Picmonic that goes over the different diagnoses, that goes over COPD and explains it with animations. So I highly recommend that you check out these different key things. There's the Nclex Nursing Labs cram sheet that is always updated every year with the new content. Lastly, if you feel that you need private tutoring, reach out to me. That's something we'll be able to do to help you. My main goal of this Nclex Bootcamp is to help students properly analyze and prepare for the Nclex. Most students that I talk to have not done 3,000 questions. They don't have 3,000 flashcards. This is the most important way for you to succeed on the Nclex. If you fail the Nclex more than once, or you're just in nursing school, this is the key critical time. You want to divide your time between doing as many questions as you can, reviewing them, making flashcards, studying those flashcards, and reviewing content. There's so many resources available for reviewing content, and remember, you can learn content until you're blue in the face, over and over again. It's the key areas of dissecting questions and learning how to do that. I remember when I was doing my psych rotations and I started learning these key core concepts of assessing or implementing, my grades immediately went up and I succeeded. And this is the key areas to your success. I wish you good luck. I wish this webinar, Nclex Bootcamp, has helped you a little bit in preparing for the Nclex. God bless and have a great day. Thank you.